One night, a 71-year-old man went to bed just like any other night. He had a normal day, felt fine, talked with his family, and followed his usual routine. Nothing seemed unusual, but the next morning, he never woke up. His family was heartbroken. There were no warnings, no signs, just a peaceful night that ended in an unimaginable loss. The truth is, after 70, some nighttime habits can quietly put your health at risk. They can increase the chances of a stroke, heart attack, or even sudden death. The scariest part? Most people don't even realize they're making these dangerous mistakes. Today we're going to reveal these hidden risks and how you can avoid them before it's too late. We'll go over 4 bedtime habits that might be silently harming your health. Some may surprise you, others could be things you've done for years without thinking twice. But by the end, you'll have the knowledge to protect yourself, sleep better, and wake up feeling refreshed. Make sure to stay until the end, because the last habit is something most older adults unknowingly do every night, and it could be putting them in serious danger. Let's get started. The first habit: eating large meals. Too late at night. Many people don't think twice about having a big meal before bed, but after 70, this simple habit can be more harmful than you realize. You might feel like it's no big deal. Maybe you've done it for years without any noticeable issues. But as we age, our digestion slows down, and our bodies don't handle food the same way they used to. What you eat, and more importantly, when you eat, can directly impact your sleep quality, heart health, and even increase the risk of unexpected health emergencies during the night. Think back to when you were younger. You could enjoy a heavy dinner late at night and sleep soundly. But now, with a slower metabolism and a digestive system that takes longer to process food, eating too close to bedtime can lead to acid reflux, restless sleep, and even sudden spikes in blood pressure. All of these factors contribute to a greater risk of heart attacks or strokes while you sleep. Have you ever woken up in the middle of the night with a burning sensation in your chest, an upset stomach, or even a pounding heartbeat? Chances are, your late-night eating habits are the culprit. When you eat a big meal right before bed, your body shifts into digestion mode instead of deep sleep mode. Your stomach releases acid, your intestines are still hard at work, and your heart rate stays elevated when it should be slowing down. This keeps you in a lighter, more restless sleep cycle and raises the risk of dangerous cardiovascular events overnight. And if you enjoy late-night snacks, perhaps a heavy plate of pasta or a greasy burger, you may feel full and satisfied at first, but as soon as you lie down, your body struggles to keep stomach acid where it belongs. It can creep up into your esophagus, leading to discomfort, coughing, or even choking sensations that jolt you awake. Over time, chronic acid reflux, GERD, can weaken the muscles in your throat and airways, increasing the likelihood of aspiration pneumonia, a serious lung infection that can be especially dangerous for older adults. Even more concerning, eating late at night can cause blood sugar imbalances. If you have diabetes or are at risk, this habit can make it harder for your body to regulate glucose levels while you sleep. Studies show that seniors who frequently eat too close to bedtime have a higher chance of developing metabolic conditions that raise the risk of heart disease. So, what's the solution? Try to have your final meal at least 3 to 4 hours before bedtime. This allows your body enough time to digest properly before you lie down. If you get hungry before bed, opt for something light and easy to digest, like a handful of nuts, a small piece of fruit, or a soothing cup of herbal tea. These choices can help you sleep better without putting unnecessary strain on your digestive system. Your body isn't the same as it was decades ago, but with a simple change in your eating schedule, you can significantly reduce nighttime health risks, sleep more soundly, and give your body the recovery time it needs. Habit number 2: drinking too many fluids. Before bed. Staying hydrated is crucial, but did you know that drinking too much liquid in the evening can do more harm than good as you age? If you're over 70 and constantly waking up throughout the night to use the bathroom, it might be time to rethink your hydration routine. Interrupted sleep is frustrating, but more importantly, This habit can increase your risk of falls, heart issues, and even cognitive decline over time. Here's why this is a bigger issue than you might think. As we age, the bladder's ability to hold urine weakens, and the kidneys continue filtering fluids even while you sleep. Your body also becomes more sensitive to fluid levels, meaning that even a seemingly harmless glass of water, tea, or juice before bed can lead to multiple bathroom trips overnight. While this might sound like nothing more than a minor annoyance, it can actually set off a chain reaction of health risks. Picture this. It's the middle of the night. You wake up suddenly with an urgent need to use the restroom. You get out of bed quickly, but your body hasn't had time to adjust. This can cause a sudden drop in blood pressure, leading to dizziness, lightheadedness, or even fainting, a condition called postural hypotension. Unfortunately, this is a leading cause of dangerous nighttime falls among older adults. What starts as a simple bathroom trip could turn into a serious injury, such as a fractured hip or head trauma. Frequent nighttime urination, known as nocturia, doesn't just leave you feeling exhausted the next day. Every time you wake up and turn on a light, your brain gets confused, thinking it's time to start the day. This disrupts melatonin production, the hormone responsible for deep, restorative sleep. Over time, poor sleep weakens your immune system, raises blood pressure, and even accelerates memory decline. In fact, studies show that seniors who wake up multiple times per night are at a much higher risk for dementia and cognitive impairment due to long-term sleep disruption. So, how can you fix this without depriving yourself of essential fluids? The key is timing. Instead of drinking large amounts late in the evening, try front-loading your hydration earlier in the day and cutting back on fluids in the late afternoon and evening. If you get thirsty before bed, sip small amounts instead of drinking a full glass at once, and watch out for hidden sources of fluids. Caffeinated drinks like coffee and tea act as diuretics, making you lose even more fluids. Additionally, some foods like soups, watermelon, and even certain medications can contribute to nighttime fluid buildup. By making these small but effective changes, you can sleep more soundly, reduce your risk of nighttime falls, and protect your overall health in the long run. If you're still with me and found this advice helpful, drop a number 2 in the comments. And if you haven't yet, subscribe and hit the notification bell so you never miss an important video. Your support helps us keep creating content that empowers and informs you. Now, let's move on. Habit number 3, keeping your bedroom too warm at night. A snug, toasty bedroom might seem comforting, but if you're over 70, sleeping in an overly warm environment can quietly put your health at risk. Many seniors turn up the thermostat or wrap themselves in thick blankets, assuming it will improve their sleep. However, a bedroom that's too warm can actually disrupt your rest, put strain on your heart, and increase dehydration, without you even realizing it. As we grow older, our body's ability to regulate temperature declines. We lose heat less efficiently and sweat less, which means our internal temperature can rise too high during sleep. When your body overheats, your heart has to pump harder to cool you down, placing unnecessary stress on your cardiovascular system. For those with heart conditions, high blood pressure, or circulation problems, this can be especially dangerous. Consider this. Have you ever woken up feeling restless, sweaty, or even slightly breathless in the middle of the night? That's your body fighting to stay cool. Studies show that sleeping in a warm room can lead to dehydration, even if you don't feel thirsty. A lack of proper hydration at night can make your blood thicker, increasing the risk of blood clots, heart attacks, and strokes, particularly in older adults. Take, for example, Joe, a 74-year-old retiree who enjoys reading in bed before drifting off. He keeps his room at 75 degrees Fahrenheit and buries himself under heavy blankets to stay cozy. However, he frequently wakes up feeling overheated and drained, struggling to get restful sleep. What Joe doesn't realize is that his warm bedroom is preventing his body from entering the deep, restorative sleep it needs for proper recovery and health. A cooler sleeping environment naturally helps your body lower its core temperature, which is essential for deep sleep, cognitive function, and overall well-being. Seniors who sleep in a cooler setting often wake up feeling more refreshed, energized, and mentally sharp. So, what's the ideal sleeping temperature? Experts recommend keeping your bedroom between 60 degrees Fahrenheit and 67 degrees Fahrenheit for the best sleep quality. If you find it too chilly, opt for breathable cotton bedding instead of heavy, heat-trapping blankets. Wearing lightweight, moisture-wicking sleepwear can also help regulate your body temperature throughout the night. Another helpful tip? Keep a window slightly open or use a small fan to improve air circulation. This not only keeps your room at a comfortable temperature, but also enhances air quality, reducing potential breathing issues that can disturb your sleep. Making small adjustments to your sleep environment can significantly improve your health. By keeping your bedroom cool and well ventilated, you can ease strain on your heart, enjoy deeper rest, and wake up feeling truly refreshed without the discomfort of overheating. Now let's discuss one final bedtime habit that might be putting your health at risk without you even knowing it. Habit number 4, sleeping in the wrong position. Most people don't think much about how they sleep. As long as it feels comfortable, it seems fine. But after the age of 70, your sleeping position can significantly impact your health in ways you might not realize. The wrong sleep posture can lead to breathing issues, poor circulation, and even increase the risk of heart failure or stroke. Yet, many seniors unknowingly sleep in ways that put unnecessary strain on their bodies every night. Why does sleep position matter as you age? As we get older, our bodies undergo changes in muscle tone, lung function, and circulation. Sleeping in the wrong position for hours at a time can restrict airflow, reduce oxygen levels, and put pressure on major blood vessels, making it harder for your body to function efficiently while you sleep. Over time, this can lead to everything from snoring and sleep apnea to more severe conditions like nighttime heart strain. For example, sleeping on your back may seem comfortable, but for many older adults, it's actually one of the riskiest positions. When you lie flat on your back, gravity causes your tongue and soft tissues in your throat to relax and fall backward, partially blocking your airway. This can lead to obstructive sleep apnea, a condition where breathing repeatedly stops and starts during sleep. Many people don't even realize they have it, yet it can significantly increase the risk of heart disease, high blood pressure, and even sudden cardiac events. Real-life example, the hidden dangers of back sleeping. Take Robert, a 76-year-old retiree who has always been a back sleeper. His wife notices that he occasionally stops breathing for a few seconds at night before gasping for air. At first, he dismisses it as a normal part of aging. However, over time, he starts waking up feeling exhausted, experiencing frequent headaches, and struggling to concentrate during the day. When he finally consults a doctor, he discovers that his sleeping position has been contributing to undiagnosed sleep apnea, which is putting stress on his heart every night. Even if you don't have sleep apnea, sleeping in the wrong position can still impact circulation. Studies show that sleeping on your right side puts extra pressure on the heart, making it harder for blood to flow efficiently. For seniors with heart conditions, this can worsen fluid retention in the lungs and legs, increasing the risk of congestive heart failure over time. What's the best sleeping position after 70? Experts recommend that older adults sleep on their left side whenever possible. This position promotes better circulation, allowing the heart to pump blood more efficiently. It also aids digestion, making it especially beneficial for those prone to acid reflux or heartburn. Sleeping on the left side can help prevent stomach acid from flowing back into the esophagus, reducing discomfort and improving sleep quality. If you find it difficult to stay on your side, try using a body pillow to keep yourself from rolling onto your back. Raising your head slightly with a supportive pillow can also help keep airways open and minimize breathing disruptions. And if you experience joint pain or stiffness, placing a pillow between your knees can help align your spine and reduce pressure on your lower back. Small adjustments, Big health benefits. Making these simple changes to your sleep posture can have a profound effect on your overall health. By ensuring that your body is properly positioned for circulation, breathing, and heart function, you can reduce nighttime health risks and wake up feeling more refreshed and energized. Final thoughts. We've just covered 4 seemingly harmless bedtime habits that can actually negatively impact your health after 70. Whether it's eating too late, drinking too many fluids before bed, keeping your bedroom too warm, or sleeping in the wrong position, each of these habits can disrupt your sleep, put extra strain on your heart, and affect your overall well-being. The good news? These habits can be changed. Small adjustments to your nightly routine can help you sleep better, improve circulation, reduce stress on your heart, and wake up feeling more refreshed each morning. So tonight, where will you start? Do you often wake up in the middle of the night and struggle to fall back asleep? Have you ever felt restless or overheated while sleeping without knowing why? Could your sleeping position be unknowingly affecting your health? Awareness is key. A small change can make a big difference over time. Try making just one simple adjustment tonight, whether it's keeping your room cooler, switching your sleeping position, or avoiding late-night eating. We'd love to hear from you. What surprised you the most from this video? Which habit will you try changing first? Drop a comment below. Your insights not only help us create more content, but also inspire others in the community. If you found this video helpful, hit the like button, subscribe to the channel, and share it with friends and family so we can continue building a healthier community together. Thanks for watching, and we'll see you in the next video.